Hi, this is Will Johansson.
And Elizabeth Spiewak.
We are pediatric residents at Norton Children's Hospital.
This is our intro to decontamination.
We hope you enjoy this video.
In a disaster scenario requiring decontamination, each member should obtain a black decontamination bag, the location of which will be shown later in this video. Each bag will contain the following: 1 chemical suit, 1 pair of chemical-resistant boots, 2 pairs of gloves, the black inner gloves, and the green outer gloves. Additionally, the bag will contain a purified air respirator, a butyl rubber hood and connection hose for respirator motor, 3 sealed air purified cartridges, and a battery for the motor.
This is the breathing apparatus. It requires 3 filters to be screwed into each side. You have to remove the cap from the top and the bottom so that you can screw each one in. The battery pack plugs into this cord, and there's a small switch on top which allows you to turn it on. Confirm with the blower noise that the battery pack has been turned on. Between the outer hood and the inner hood, there is an input for the hose which connects to the breathing apparatus. Make sure to turn the breathing apparatus on before placing the hood.
When putting on the jumpsuit, you may choose to wear shoes or not wear shoes. Just make sure that before you zip it up, you have enough room to tuck the back of the hood, which we will show later in this video.
Place the black inner gloves on the inside of the wristband of the jumpsuit. Place the green outer gloves over the wristband of the jumpsuit and seal with duct tape. Fold the edge of the tape over in order to make a tab for easier removal. Wrap the duct tape around the wrist in order to create a seal between the outer glove and the bodysuit. The chemical-resistant boots have no arch support, so you can choose to wear your own shoes inside the boot to be more comfortable. In order to prevent water from getting inside the chemical-resistant boots, you can create a cuff over top of the boot with the bodysuit, or you can seal the boot directly to the bodysuit. Here we demonstrate both techniques. Roll the jumpsuit hood down in order to tuck the ventilator hood in place. Turn on the breathing apparatus prior to placing the hood over the person's head. When placing the hood, ensure that the battery pack is accessible in the front of the hip of the person wearing the hood so that he or she has access to the on-off switch. Have the person wearing the decontamination suit hold the battery pack as the assistant places the hood over his or her head. Tuck the inner hood into the bodysuit and allow the outer hood to drape over the bodysuit. After zipping the bodysuit, peel this tape off and stick the flap across the bodysuit. Assist the person in clipping the belt around their waist and ensure that it's tight enough to stay up on their hips. Verify the airflow throughout the bodysuit and hood by ensuring that the mask is not fogged up and that the top of the hood is inflated. In a true disaster situation with several people dressed up in contamination suits, it's difficult to identify, so you can write the name of the person on the back of their hood. When patients enter the shower area, they are considered contaminated, which we will refer to as hot from here on out. Patients are asked to remove their clothing and progress through the shower area to become decontaminated. The person working at this end of the showers is in a decontamination suit and is considered clean, which we will refer to as cold. At this end, there will be towels, blankets, and gowns for patients to wear after becoming decontaminated. They will enter back into the ER through this door, which leads into one of the rooms in the A hallway. Here we're demonstrating washing off a contaminated or hot patient. Help the person unclip the belt and have him or her hold it in one hand in order to facilitate removal of the bodysuit. Remove the duct tape seal by using the tab you created when placing the duct tape. Remove the outer glove, but leave the inner glove on at this time. Tear the seal or cut if necessary and unzip the bodysuit. Take the bodysuit down in one piece and be careful to leave the black undergloves on. Remove the top hood in one piece. Remove the undergloves using standard PPE technique.